Dr. Hadil and all the organizers, and nice to listen to all the talks before me. As spoken before, very simple basics about passive immunity. Just talking about the difference, defining the difference, defining passive immunity in contrast to active immunity, and examples of passive immunity uses and the difference between it and active ones, as I said. Define a passive immunity as immunity obtained by transferring readily made antibodies in another host to or on a donor to transfer them into the host. So the antibodies are passively transferred, as we said, so you don't need the immune system of the host to actually mount the same immune response you'd expect in active immunity. Protection from passive immunity is very short. It diminishes in a very short period of time, not very, but in a short period, something in weeks to months. An example of this that happens naturally is like the immunity transferred via the placenta from the from the mother into the baby in the last trimester, which is IgG, and it can last about 4 to 6 months. Protection is also another example, could be the antibodies transferred via breast milk into breastfed babies. Next slide, please. Basically active immunity requires an immune response, including cellular as well as eventually humoral immune response. When someone gets infected with a virus or a bacteria or any foreign antigen comes into the body, the foreign antigen or the virus particle gets shown on the surface of the T cells of the antigen presenting cells, and when the T cells recognize the antigen particles via the MHC class 2 or class 1, then there is a cellular response, which is mainly start with activation of division and activation of T cells, which then cytotoxic T cells can actually kill viral infected cells. It can also activate B cells. So I'm not talking according to the slide because I think but yeah, if you look at this picture, this is basically an antigen presenting cell presenting an epitope of a virus or of an antigen, which then stimulate the T cell. And as I said, cytotoxic, there's a cascade of immune response, including cytokine release, which help division and activation of immune cells. Cytotoxic T cells directly kill viral infected cells. Also, B cells are activated and they turn into plasma cells and make antibodies, as well as some of them turn into memory cells when the infection is over. Also, some of the T cells turn into memory T cells for further, if another infection happened, then it's recognized and it's early responded to. And now this is all, I think, related somehow to active immunity, and even including the antibody production inside the host is still active in a way. Passive immunity, meaning taking these antibodies or these antivirus or certain antibodies to antigens readily made from a host. That can be another donor or someone who was a patient before who managed to make these antibodies, readily take them, infuse them passively into a host that has a viral infection, and then you'd hope they will neutralize the virus. Now, the virus, as I said earlier, can be removed by the activated T cells, but it can also be removed by the antibodies. So the antibodies are basically proteins. They can act in so many different ways, at least 3 main ways to actually get rid of the virus. Very simple. First one is actually neutralizes the virus, so makes it unable to actually invade the host cells and infect it. A second way is by agglutination. So basically, the antibody is stick to the virus, and sometimes make many of the viruses particles stick together, which make them more susceptible to the host immunity, but also make it impossible for them to invade the cells. So this is what passive immunity is all about. As I said, examples are transfer of immunoglobulin from the mother in the last trimester into the baby, which can last for about 4 to 6 weeks. And then also in breast milk, Historically, this has been used many times before. This is not the first time. Since 1980s or 1970s, it has been used for many previous infections, for Ebola, for influenza, for many measles, for many other viruses. I don't think I can see the slide at all, but the last thing I want to say is the difference between passive and active immunity. So passive immunity, as we said, they're mainly antibodies. So there is no cellular component, as you've heard Dr. Ghazali earlier talking about the cellular immunity as well. So here is just a picture showing how the antibodies can cause agglutination of the viruses, which makes it more susceptible to more amenable to immune cells, but also makes it impossible for them to invade the immune the cells of the host. So the main thing to remember about passive immunity is that it's not long lasting. It normally lasts about a few weeks to a few months. And typically, as we said, the immunoglobulin given, as well as the specific antibodies, as well as the immunoglobulin passed to the baby from the mother. They last, any time from weeks to months. Of course, there's no cellular immunity components at all whatsoever. And as we said earlier, it's not permanent, and it might have to be given more than once. I think that's all I had in the slide, but I can't see the slide. Thank you.
Dr.